Choosing the right size munchie. We know that chewing is something that is great for everyone of all ages. So if you just want to get on with chewing your munchie for the oral exercise and hygiene benefits, then head over to our munchie sizing guide and get started. The 3 most important factors for you will be age, intercanine width measurement, as well as overall build. Match them up with the sizing guide recommendations and you should be all good to go. But choosing a munchie for your child can be a little more complicated. We know that children grow at different rates and stages, so it's important to factor this in as well when finding the right size munchie for your child. So always have a look at their age and their build. Our munchie devices are broad in their age range for each size, and the recommendations for age and size is made on what ideal growth would look like. When we have less than ideal function, we can need to start smaller with munchie size and work our way up. This can be particularly important during the transition stages. Other factors we will need to consider are, do they have a history of oral dysfunction such as tongue-tie, pacifier use or thumb sucking? Do they have a mouth breathing pattern? Is there developmental delay or sensory processing issues? Or do they have special needs such as Down syndrome or cerebral palsy? There are many different things that can affect the way a child engages with a munchie, and we want to make sure they have the best experience possible. For those who are wanting to achieve a certain outcome or treat a symptom or solve a problem, such as dribbling, drooling, mouth breathing, undeveloped jaws and crooked teeth, some thumb sucking or pacifier habits and snoring, we need to consider what the underlying cause of the problem is before we can decide what the right size munchie will be. So if we have mouth breathing, dribbling, drooling, messy eating and unclear speech, for example, the underlying cause is likely to be low tone. So starting with a munchie that is a small enough size to be managed easily is going to be really important here. They need to be able to get their lips together around the munchie comfortably and then chew. So start with a smaller size and move up to the next size once they can manage well for their age. This is particularly important for the child in the transition age group between 4 to 6 years. If they have had prolonged pacifier use and thumb sucking, then this will often cause narrowing of the arches, and once again we have the jaws being smaller and maybe some low tone around the mouth as well. So these children may need to start with a smaller appliance and move up to a larger one once they can manage it. And the same with malocclusion and crooked teeth. If the balance of the teeth are crooked and the jaws are out of alignment, then the muscles of the lips, face and jaws are not working in the perfect balance we'd like to see. So if you do have conditions or concerns, you'd be well served to seek the guidance of a certified munchie practitioner on sizing and advice for use. Have a look at our Munchie Certified Practitioner page on our website. So hopefully this makes it clearer for you to choose the right size munchie to meet your needs.